Welcome to the Future of Ground Transportation podcast, where we discuss the exciting innovations that lie ahead for organizational ground transportation. Each episode, we cover topics tailored to those resolving transportation-related challenges and provide tips, tools, and trends that will inspire you to stay ahead of the curve. And now, here's your host, Daniel Perez.
Welcome to the Future of Ground Transportation. Today we have two special guests, Brooke Ramsey and Josh Albertson from the Iowa Regional Transit. Thank you for joining the podcast tonight. How's your night going so far?
Good, thank
Doing
you.
well.
It's awesome. It's awesome. So let's get started. If you guys want to introduce yourselves and a little bit of context about yourselves and about your organization. Brooke, you want to get started?
Yeah, thank you. So I'm Brooke Ramsey with the Heart of Iowa Regional Transit Agency, better known as HIRTA. And I'm the business manager. So I handle a lot of project management and grant writing, which is how I got placed on the Health Connector project, where we were lucky enough to find Josh.
Yeah, great to meet you. My name is Josh Albertson. I'm the Director of Advisory Services at a company called Flexlynqs. And we've been serving as a consultant for HIRTA on this Health Connector initiative over the last several years now, dating back to 2020. Thanks for having us.
Thank you. So tell us a little bit about the Iowa Regional Transit, Brooke. You know, how many counties do you guys service? How many cities? Who's your audience, and what is your main objective?
Sure. So HIRTA provides service in 7 counties in central Iowa, which may not mean anything if you're not familiar with our state. So it covers about 4,100 square miles and includes 87 different cities, not including the unincorporated areas. There are a couple of communities that are suburban because we do surround the greater Des Moines metro area. So that kind of confuses people a little bit because we don't actually serve the city of Des Moines.
Thank you. What about you, Josh? Tell us a little bit about Flexlynqs.
Sure, yeah. So we've started a new company, my boss Santosh and I, and a couple other folks, and it's a new consulting company. We're targeting all kinds of new transportation and new mobility efforts, and really trying to embrace innovation and technology with our partners at transit agencies and other groups that are putting mobility first. And our mission is really to make mobility possible for everybody, not just folks that have a car, but really across the spectrum, using all different kinds of travel. And we're trying to emphasize technology and data as a way to get that done. So that's a little bit about us.
Awesome. Thank you. So Brooke, tell us a little bit about your, first of all, how did you get started in the transportation sector?
Oh, well, HIRT has been around since 1981. I joke we're the best kept secret in any town, but we're actually a governmental body. So we were established simply to provide public transportation in our 7-county region.
Okay. But how did you got started in the transportation or into HIRTA? Like, what brought you into HIRTA?
Well, I don't know many people who would say they grew up wanting to be in transit, but I think most of us are just kind of fell into it, and then we just love it so much we can't leave. Transit is a wonderful industry to be in because we all help each other. You know, what's happening in another state and their challenges and their struggles are the same usually as ours, which is kind of ironic given that we're so far away. But it's the most helpful group of people because why recreate the wheel when somebody already has a plan or a policy? They're usually willing to share it. So once you come on board, you tend to be a lifer. I've been here over 14 years.
Oh, wow. Good for you. Awesome. So tell us a little bit about the challenges. I know when we were preparing for the recording, you mentioned about the barriers and how HIRTA sort of connects so many links throughout the city, but most importantly, the challenges that you guys experience, but most importantly, how you guys mitigate the friction for your residents. and how you guys bringing value to your community as well.
Sure. So, one of the things that transit hears a lot is how we are a barrier to access, and that can be anything: accessing healthcare, accessing education, accessing employment. And so HIRTA wants to kind of turn that conversation around about how we're part of the solution, not just our agency, but transit as an industry is part of the solution to the problem. That's going to take a couple of things. It's going to take people willing to be innovative, which is where Josh's team can come in and help. And it's also going to take a community partnership. So, for example, on this project, we partner with the public health department. And just by having a relationship with them, you get invited to the table. So you get to be part of the conversation. And then in turn, you can leverage those individuals to help you when you're looking to implement something new and provide feedback and make other connections. So, you know, it takes all of us to be part of the solution, I guess, is what I'm getting at. And I think that's why this project has been more successful. But Josh, do you want to talk maybe a little bit about some of the outreach efforts that we've done or the types of stakeholders we've worked with?
Yeah, sure. So I think implementing any kind of new transit service or operation kind of requires a lot of coordination between planners and operations staff and anybody within a transit agency. But for this Health Connector project, we've also had to do a lot of outreach and coordination with local hospitals, public health departments, um, you know, other social workers and folks in the community to really understand it and leverage the system to its fullest extent. And so as the system has moved from kind of a design and concept stage into now operations where we are, um, we've had to do a lot of outreach on the ground, like I mentioned, at hospitals and at public libraries and, doing webinars and marketing events just to kind of make people aware of the service and let them know that there's a new opportunity to help people get to the pharmacy or to their medical appointment that they might need to get to.
Got it. So a lot of awareness, pretty much.
Yeah, absolutely.
Got it. And when you mention innovation, Josh, Brooke mentioned innovation. Like, what sort of innovation comes to mind that you guys are sort of creating or implementing within the system?
Sure. Well, I'd be happy to talk a little bit about kind of what has been implemented for Health Connector and kind of the different technology components of that. So as Brooke mentioned, I mean, HIRTA does hundreds of trips per day. One of the key elements of being able to get to your healthcare appointment on time, we felt, was being able to do that in an on-demand setting. So not necessarily reserving your ride the day before, but if you're at the hospital, you don't know when it's going to end, being able to just take that trip back right when it's over. So implementing a new mobility on-demand platform that allows for on-demand booking was one aspect of this project. Um, a key piece of kind of the ITS for us effort that this is funded under from the USDOT is that it also exemplifies kind of complete trip end-to-end solutions. So it's not just about what's going on board the vehicles, it's also helping people get to the vehicles and helping them once they're off the vehicles as well. So there's wayfinding technology that we've been implementing on the buses and at the healthcare facilities to help people navigate all the way from their front door to their exam rooms, for example. So that's another piece of it. Yeah.
That's pretty cool. That's pretty cool. So tell me a little bit more about the on-demand booking service. Are you guys partnering it up with other booking apps? Like, how does it work?
Yeah. So, Brooke, I'll answer some of this and feel free to jump on. We partnered with VIA on this effort on this project, and so that's kind of the mobility on demand platform, and so that includes the central booking software and the traveler application that they can use for booking, and a driver application that you can use as well. One of the key parts of the project, though, is to design everything so that it's as replicable and scalable as possible. So it's not to say that you need to go out and procure like VIA for this project, although they've worked great. You could theoretically be able to do this with any kind of MOD platform.
Got it. Thank you. And as far as data, what sort of data enhancements have you guys sort of implemented in this project, and how's that going so far?
Yeah, it's good. I think this is kind of the first opportunity we've had to actually collect data. And so one of the key deliverables from this is performance evaluation and looking at KPIs related to health outcomes, missed appointments, and cost savings from reduced missed appointments. And so we're just starting to see some of that data come in, particularly as trips get taken. We just officially kind of launched operations in mid-August of 2024. So as we get more data, we're excited to kind of see what the results are telling us. But we're hoping that it really makes a difference in terms of helping people get to those healthcare appointments.
Got it. Thank you, Josh. And as far as when you mentioned the innovation, the on-demand booking appointments and the data, what has been the biggest struggles for you guys or challenges as you continue to sort of revolutionize and improve the system?
Yeah, so I'll take that one, Josh, if you don't mind. A couple of things. One of our goals let me say the first and largest challenge we had was the partnerships. So we thought, because of years of hearing about how transportation was the barrier to healthcare, and going into the project proposal to the US DOT, we had on board the public health department. And obviously, they have access to all of the healthcare providers. And keep in mind, this was in July of 2020, heat of COVID, and the healthcare systems were overwhelmed. So when we were awarded the project in January of 2021, we were really excited, announced it, said, let's share this information out, let's get the partners on board. And that was our biggest challenge. They were overwhelmed with the pandemic. That may have been part of it. But we really thought that this was a no-brainer. We had this project funded. We weren't asking them to put any money into it. And in hindsight, I think that was a mistake. I think we should have had them submit with us letters of support, letters of commitment upfront. So that's something we'll be doing in addition as we look at replication moving forward. But that was definitely a challenge and a barrier, was to get them to commit time and staff to sit at the table and be part of the planning. Another challenge that we had just in general was limited English proficiency in some of our communities. So one of the communities in the pilot area is the city of Perry, which has the largest per capita Latino population in the state of Iowa. So about 36% of the population of that community speaks Spanish. And we wanted to make sure that we include them and meet people where they are, so that everyone is able to take advantage of the benefits of the project. And in looking at our LEP plan, we needed the service to be available in more than English and Spanish. So we had to work with VIA to make their technology available in 4 languages, which for us, the top 4 spoken languages in our region were English, Spanish, Mandarin, and Arabic. And so that was something that was a little bit challenging, because at the time the app they had available only was available on 2 language options. So working with them to understand the importance and make sure that they could get that incorporated was a key part of the project. Josh, did I miss anything or anything you want to add to that?
No, I think that's right. And I think when you spoke about the language barriers, that was something that we've been trying to address in some of the wayfinding technology too. So we're using a system called Navalens, which is primarily for kind of wayfinding assistance, location assistance. But one of the benefits of it is that when you scan essentially what resembles a QR code, it can also translate any information into 33 different languages, which comes in handy when people are looking to identify things in languages other than English.
Got it. And tell me a little bit about your ESG initiatives. Are you guys looking to sort of transition a little bit to, electrical vehicles or just cleaner fuel sources? I know we talk a lot in this podcast about, how companies, especially transit agencies, are moving more to electrifying their fleets. So just curious to see where you guys are in that sort of wave.
Well, I have some really exciting news I'm not allowed to share until Friday, but I will say that yes, we are very excited to step into some electrification. We actually have, I could probably have a whole nother topic on this with you a different day, Daniel, honestly. But we have been in the past awarded some grants for low or no emission vehicles through the FTA. So that is something that we will be implementing soon. We're actually working on a facility project to build a new maintenance facility with indoor bus parking to store the electric fleet, and we will be moving our administrative offices there as well. And then, as part of our Health Connector project, part of what we had to do was an operational readiness demonstration for some members of the USDOT to show them that all of the work and the technology, everything we had developed as part of the project was actually ready to go into service. And when they came out and were on site with Josh and I and the rest of our project team, some of the engineers were so excited. They were already talking about ways. Have you thought about how autonomous vehicles might fit into this? Have you thought about how this might fit into it? So they were already brainstorming beyond the work that we've done in other ways. And we were like, we thought about it, but we haven't had time to get there. So I do think as the technology kind of improves and might be leveraged more, not only into rural environments or rural use cases, but also we're in central Iowa. So we have to make sure that the vehicle types that we're implementing are things that will work in the snow or in the freezing rain or in the extreme cold temperatures or during a polar vortex. So things we want to try out and test, but we want to make sure that we do them in a way that is going to benefit the service and not pose a challenge to day-to-day operations too.
That's very well said. Thank you. Josh, anything that you would like to add?
No, I think that's great. I mean, we work on electric vehicles a lot, kind of have worked on it with a number of agencies in the past and excited to see more and more agencies kind of move in that direction towards cleaner fuels. So I think you'll kind of see that and more as transit agencies kind of catch up and utilize that FTA funding. And I think the biggest thing is really building out the infrastructure from here, because I think we'll have the vehicles, and now just getting that grid capacity to catch up is kind of the thing on everyone's minds.
Yeah. Thank you. And as far as the projects that you guys are more proud of, that you guys currently working on, you want to elaborate a little bit more on the projects that excite you the most within your organization?
Well, I think the Health Connector is the one I'm probably most excited about right now, mostly because, as Josh and I talked about, we really started this back in July of 2020 with the proposal and getting the award in January of 2021. So we spent, a year and a half just in doing the research, because this is really an R&D project, a research and development project. And so going from the research to the development of a middleware technology that can communicate with the healthcare's electronic health record. It can communicate with our scheduling software. It can communicate with the state Medicaid brokers technology to automatically ingest trips to help streamline the process for that population of ridership. It can do a lot of amazing things. And again, as Josh mentioned, we've actually posted the code for that middleware technology on our GitHub account, so it's available for free for others to implement something similar in the future at lower cost. Of course, it'll take some funds to set up in their system, but it will help greatly reduce the cost and the time. But now to finally have it in operations and to be able to start pulling down the data and talking about that, I'm used to project management being like a 12-month thing. And this is about 4 years. I'm so excited for it to stand up on its own and to be able to share that with people.
Wow, 4 years. That's amazing. And you mentioned there's an integration with the sort of the health system that it integrates data back and forth. Tell us a little bit about that.
Yeah, Josh, do you want to talk about maybe like the dashboard and stuff too?
Yeah. So one kind of key piece of this project and a lot of what we do is a lot of systems integration work. And so we started with a concept around, what would it be like if you could have the information on somebody's health appointment bookings and whether they have a ride to or from that appointment booked at the same time, at the same screen. So we've been able to do is take healthcare appointment data information from one of the local hospitals and the transportation booking information from the Health Connector mobility on demand platform and present that on the same screen so that you can quickly and easily identify folks that have an appointment, whether they have a ride to that appointment or not. And if they need one, it's kind of a quicker way for care coordinators or social workers to follow up and make sure that they're getting a ride if they need to. So things like that have been really cool. And it's something that's designed to work with, basic SSIS package exports. So it could be something like that, or we've designed a version and are working towards doing this with Epic and using APIs and things like that. So that's one of the project aspects that I've been really excited about as well.
Got it. Thank you. All right. So tell us a little bit about the best business advice you ever gotten.
Josh, you
I'm gonna go first. Well, I mean, we work with a lot of different transit agencies, a lot of organizations. I think the best advice that I ever got is that, no two agencies do anything the same. I think regardless, you could have the agency in the same region and in the same part of the country, the same size and everything, and they do things completely differently. So part of this project has been obviously designing solutions that are scalable and can apply to a whole wide range of situations, but that unfortunately doesn't mean that you get to just take the exact same work and copy paste it to anywhere else in the country. So that's definitely been a lesson learned for me, and it holds true pretty much anywhere I go. It's like folks face the same challenges, but you got to adapt your solution to right size it and meet their needs.
Awesome. Great advice. Brooke?
Gosh, I feel like I've had so much advice from peers over the years, so that's a really difficult question. But um, I think one thing I would reiterate to others is, you know, it isn't always a straight line from point A to point B, especially when you're working on a project like this. Sometimes it's a very squiggly line, but just, stay the course and remember why you're doing things and make sure that you listen. Um, in this case, for the Health Connector, I would say we relied heavily on consultants, not just Josh and the Flexlynqs team, but we had several outside agencies from a marketing firm. Capture Management was our marketing firm. We partnered with CTAA, which is the Community Transportation Association of America, to help us with the participant education and recruitment plan and many other things on the project. Iowa State University. I mean, there's just been a slew of different people that have helped us. And so sometimes just turning things over, which I'm not used to, and saying like, hey, Josh, what's the best practice here? Or hey, Iowa State, how should we be doing this? And just trust them and let them be the experts in the room. So I guess that's a lot of advice.
Yeah, no, that's
Just so question.
that was well said. Appreciate that, Brooke. Perfect. Thank you. Is there anything that we missed that you guys would like to share with your audience within the Health Connector or with other transit agencies that are going through similar programs that they could benefit from, your experience of, going through all these journeys, or with private companies that are working with transit agencies like us, right? Like we service we service routes for other transit agencies across the country. So, I know this is a loaded question, but what comes to your mind as you guys work on the Health Connector that you would like to share with the audience?
You want me to go first?
I can go. I was just gonna say, I think kind of what comes to mind with this project is that there's so many different things going on. Um, and it doesn't all necessarily have to be at once. I would kind of encourage folks to read about the project, pick out maybe even just one thing that could be a part of the solution that makes transportation kind of a part of the answer to solving the problem, and see if that's something that can be kind of implemented locally. So what maybe that's just one kiosk that helps people book rides back from an appointment, or maybe it's just wayfinding, technology that helps people get, from the bus to their exam room or whatever it is. I think there's kind of a lot of different components that could help with this, and it doesn't have to be, that you're waiting for a huge grant to come through to do that. Maybe it's just a matter of applying a little bit of code and a little bit of funding in one specific area to make transportation part of a solution. So that would be kind of my take home message and what I hope folks can take from this.
Perfect. Thank you, Josh. Brooke?
I feel like I'm going to give you a loaded answer. So I've said this for a long time, but I think the best thing for any transit system, no matter how big or small you are, is to have something in your back pocket. You have a project that you know is something you want to work on. And it could be a huge dream or a small dream, like Josh just mentioned, and have that project kind of ready. And then when there's an opportunity for a grant, whether that's through FTA or through a local private foundation or, any type of opportunity you have to fund it, you're kind of ready to go. So if you have a dream, even if it sounds kind of big and crazy, like develop that a little bit. Make some notes on it. When you think about things or you have a problem, like jot that down and keep that somewhere. So later when someone says, "Hey, did you hear about this opportunity?" You could be like, "You know what? That's my ticket. That's the one I'm going to build on this with." And if you have to start with just part, like Josh said, that's great. At least you're working on it. But if you don't have something kind of ready, then you'll never get it done. You won't be prepared when there's an opportunity available. The other thing I would highly encourage, especially for small to medium-sized systems, we don't have a lot of staff. So it's difficult for us to have an expert in everything or to even dedicate time to a project like this. So that's part of why Career relied heavily on consultants. Don't be afraid to leverage them. In some cases, they'll help you with the grant writing so that you can even get the project started or fund it. Um, and I think that's something we could all benefit from because people like Josh are an expert in his field and he has many partners he's working on. But taking advantage of the opportunity to work with Josh and his skill set has been able to help us move forward with this project that we couldn't ever undertaken on our own. And we wouldn't have made sense to hire somebody full time when that's only a minimal amount of time in grand scheme of things that the project is going to be, really worked out before it's like that service and we move on. So a couple of different things there, but consultants are not a bad thing. Trust them. And, definitely happy to talk more about that with anybody that has questions.
Got it. Thank you. So, Brooke, how can listeners learn more about the Health Connector, or if they would like to connect either with you, Brooke, or Josh, how can they go about it?
So we actually have a website just for the Health Connector that's transithealthconnector.org. And we have some great toolkits that are for partners, that are for stakeholders, that might be for writers, lots of things that people can pull down, PDFs, how-tos, videos. We've got great training videos and resources on our YouTube channel. There's a whole link tree of resources for the writers and partners. Of course, you can contact me. So you can reach out to me at anytime you have questions. And Josh?
Yeah, I think that's exactly right. I would say, as part of this kind of federal effort, all of our documents that we've done, concept of operations, all that type of thing is available online too through the ITS website. So it's its.dot.gov/ITS for us. And that has our project and also the other ITS for us projects going on around the country. So that could be really helpful too. And like Brooke, I'm happy to answer any questions from anybody who might have questions about this project at any time or some of the stuff that we're trying to figure out here.
Perfect. Again, Brooke and Josh, thank you very much for participating tonight on the future of ground transportation. And I hope for all the listeners that you guys had found very valuable, and stay tuned for the next episode. Thank you, Brooke and Josh. Have a great night.
Thank you.
Thanks, Daniel.
Bye-bye.
Hey everyone,
Thanks so much for tuning in today. We hope you enjoyed the episode and got some valuable insights. If you're curious to learn more, head over to the resource website at dpvtransportation.com, where we got a ton of useful resources and tools for you to stay ahead of the game. And before we wrap it up, I want to invite you to book a free guest admission consultation or a consultation about your ground transportation program with us. Just register on our website is a fantastic way to see how your fleet is doing or how your overall program could be improved. Thanks again for joining us, and we will catch you next time on the Future of Ground Transportation. Have a great day.
Thanks for tuning in to the Future of Ground Transportation. We appreciate you coming along for the ride. If you found value in this episode and want to hear more, please make sure to subscribe to the show.